Hello, and welcome to the American Heart Association's Red Chair Series, sponsored by Rochester Regional Health. I'm your host, Christy Smorrell with the American Heart Association. In this series, we're going to talk about a variety of health topics, delving into things like risk factors, health disparities, and what you need to know to protect yourself and your loved ones. Today, we're going to focus on the #1 killer of women. Cardiovascular disease claims more women's lives than all forms of cancer combined. I'm joined by Dr. Uzma Iqbal, cardiologist and program director for Women's Heart Health and Cardio-Oncology with Rochester Regional Health. Dr. Iqbal, how does heart disease present differently for women versus men?
So the most common symptom for heart disease is chest discomfort, which is very common both in men and women, which is usually presented as chest tightness or chest heaviness. But women can also present differently, meaning they can have abnormal sensation in the upper part of their body, which can be tingling sensation or a sharp pain. They can have pain down their arm, neck, or jaw. They can be more short of breath, more tired than usual, which can all be kind of symptoms for heart disease.
And are risk factors different for men and women?
So risk factors, the traditional risk factors are common for both men and women, which are high blood pressure, diabetes, cholesterol, obesity, smoking, or family history. But there are risk factors that are specific for women, meaning how they did during pregnancy. So if they have had adverse pregnancy outcomes such as blood pressure elevation during pregnancy or eclampsia, preeclampsia, if they've had miscarriages, if they've had gestational diabetes, any of those things puts those women at higher risk of developing heart disease later. There are also other risk factors for women that are different than men. Women tend to have more autoimmune diseases, so lupus and rheumatoid arthritis, that increases their risk significantly. Also depression, which is very common in women, especially postpartum or postmenopausal, that tends to increase their risk. Another thing that's common for women is breast cancer, and then treatments for breast cancer that puts them at higher risk, which can be cardiotoxic medications that they get through their treatments, or if their cancer was left-sided, getting radiation to their left side.
In your practice, what are some of the most common questions women ask you?
So I get to be asked, is this heart disease related? So if they're having arm pain, is this heart related? So what I have to do is to sort of see if they're at risk or not. And the other thing is that they do ask. There's a lot of awareness with social media and Apple Watches. Am I at risk? A lot of women that come in are going through their different stages in their lives. So I see a lot of postmenopausal women who have been fit all their lives, and all of a sudden they have menopause and their cholesterol numbers are going up and their weight is going up, and they are concerned about their cardiovascular risk.
That's great that we're raising awareness and women are asking these questions. What about health disparities? What should women be aware of in that case?
There are certain races and ethnicities that are at higher risk of heart disease, and they do worst with if they have heart disease, such as African Americans, Hispanics, South Asians. But women in general tend to have worse outcomes. They're under-recognized, under-treated, underrepresented.
If there was one thing that a woman could take away from this video, what would you want it to be?
I don't think there can be one thing. I think that women need to know what God could represent heart disease for them, and they also need to know that what puts them at risk, so they can control those risk factors. And I personally feel that women need to know their numbers. So they need to know what their blood pressure should be, or what their BMI should be, or what their cholesterol number should be. Just like you need to know whether your mammogram was normal or abnormal, I think if you're going to a provider, you need to know, are all my numbers in order? So if there was one thing, I would say they should know all their numbers and whether they're at risk or not.
That's great advice. Thank you so much. We're going to get into a lot more topics in the Red Chair series, so stay tuned.